It's Charles Barkley with Wayfair. It's outdoor season, and my patio setup better be ready to play. That's where Wayfair wins. Patio seating, umbrellas, and grills, all delivered fast and easy. Shop wayfair.ca now.
Wayfair, every style, every home.
It is the third hour of the Elias Macko Show. Happy Wednesday, by the way, as we make it to the midpoint of the week. You know what? Dr. Don Vinh is on the line. Let's go straight to him. I won't even do the intro. I go to Dr. Vinh first, then intro. Dr. Vinh on the line from the MUHC, infectious disease specialist extraordinaire. Welcome back to the show.
Thank you for having me, Elias.
I introduce you first because today I will be giving the COVID numbers, which I have to be very honest, Dr. Vinh. Over the last few weeks, I stopped doing it like I was doing every single day because it feels like the vibe is we're moving on. But here are the numbers. 3,067 new cases. Of course, not everyone can get a test, but those numbers are up in sheer number. 8 new deaths being reported. Hospitalizations at 1,200 even. That's an increase of 47 compared to the previous day. There are 60 people in intensive care, decrease of 3 compared to the previous day. Vaccination campaign just shy of 9,000 doses administered. Now, Dr. Vinh, seems like anecdotally, seems like many Quebecers have COVID right now. Our very own Jay Farrar in Master Control was out last week due to the vid. However, interim Public Health Director Luc Boileau is saying it's still too soon to declare a 6th wave. Dr. Vinh, what say you?
No, we're in the 6th wave. I mean, with all due respect to public health, they have been consistently behind the 8 ball at multiple points after their first wave. So, I mean, at least they're consistent in that aspect. But I think it's very clear when you see an increase in community cases and an increase in hospitalizations. I think I think it's pretty compelling that we are in the 6th wave.
So I know we can look at the numbers from the beginning, mid-December of 2021, and we can say, oh, geez, look at this number. This is higher than certain points of December last year when the 5th wave was beginning. But Dr. Vinh, it certainly feels different right now. You know, it certainly feels like this is another stage here of the pandemic where we don't care as much about those numbers.
Well, let's face it, everyone is COVID fatigued, right? And I think that's contributing to a little bit of people, the apathy that we have. And the other thing we also have to be aware of is we are in the start of the 6th wave, but we don't know the impact of that, right? Because this wave, which is driven primarily by BA2, is so superimposed or close to the BA1 wave that we're coming out of, that it's possible that it will be mitigated in terms of its impact, so that we may see increases in community cases. We're seeing increases, for example, in the long-term care facilities of the elderly. We're seeing some increases in the hospitalizations, but it's very possible that the effect will be blunted. And so between the apathy that people have and the potential, the unpredictability of the impact of this wave, I think this is putting us sort of in a big question mark category of, well, what's going to happen in the next few weeks?
Dr. Vinh, when you see that, so many things are just back, we're sort of quote unquote back to normal in sort of restaurants and going out and the bars and clubs are open and there's 21,000 people at the Bell Center. And then keeping all of that in mind, that so many of us are traveling and trying to get back to the quote unquote normal. And then the numbers are at the level they are, the hospitalizations are at the numbers they are. Do you say, oh, geez, maybe this could be a positive sign that the numbers are still at that level despite things being reopened?
No, I think that we have to be a little bit careful of what the numbers are because they're not reliably, telling us what's going on, right? Because of the fact that the numbers are somewhat selective. But I think we have to look at what are the indicators. The indicators are severalfold. Like I mentioned before, right? The RPAs and the CHSLDs, they're starting to see outbreaks. But again, we don't know how sick those are. We're starting to see outbreaks related to a concert, outbreaks related to gyms and restaurants. And so what that's telling us is there's definitely ongoing community transmissions sufficient enough to be able to hinder social activities. And as we know, right, there's an increase in healthcare workers, which is, of course, the other threat to our healthcare system, not necessarily a huge number of hospitalizations of patients, but a decrease or an undercut of the available number of healthcare workers. So all of these are pointing that there's definitely ongoing community transmission, enough to hamper all of those social activities that I gave examples of. And I think that we have to be a little bit careful that we're not misled by a selective testing policy.
We're with infectious disease specialist Dr. Donald Vinh from the MUHC. So with that in mind, Dr. Vinh, What do we do about it? It doesn't seem like there's any appetite politically and from the public for a restriction like closing and or anything like that. But I'm sure there are some things we could do right now to ease what's going on. What can we do? What should we do?
Well, I think that we all agree, right? Nobody in the government, the public, healthcare workers, nobody wants to go back to that lockdown, that intense lockdown we had 2 years ago. Nor do I think that that's what we need, right? But what we do need is prudence. If we don't know what BA2 is going to necessarily do, but we have data from other parts of the world that tells us it's 40% more contagious than the Omicron BA1 that we just had. And we saw what BA1 did, right? It targeted enough people to be able to threaten our healthcare system. I think what that tells us is that we just need to remain prudent. And that by definition means that we have to rethink what some of these measures that we're going to, that we're earning for, right? Like, are we going to really allow large gatherings that are sort of, a full capacity, unregulated? I think that if most of us who have common sense, there's a voice that's screaming that says, well, that does not make any sense whatsoever. And I think that that's what we have to do. We have to say things like, if you're going to go to indoor places, especially in places where the buildings may be a little bit outdated or dilapidated, they may not have the ventilation that's adequate for an airborne infection, you wear a mask. If you're going into a place and it's crowded, maybe you don't go in right away. You go at some other time where you try to avoid large gatherings. You try to maximize ventilation. And I think that both the governments, federal and provincial, also have to incentivize for business owners and building owners and that kind of stuff to try and improve ventilations. Because if we're going to change the healthcare system, which is what we've heard, it's going to be the public health that we have to focus on, right? It's not just the care in the hospitals. We have to think about things that lead to hospitalization. And if we can decrease that, then of course we can save our hospitals. And one thing to do here is to maximize ventilation measures.
Okay, and on the subject of decreasing hospitalizations, I want to talk about vaccination as well. I just pulled up my record. I just pulled up my Vax Pass, Dr. Vinh. So right on board, as soon as I could get my dose in May of last year, I got my first dose. 8 weeks later, I get my second dose, right? That's at the end of June. Then this January, I get my booster, okay? So I got boosted in January. Do you think at a certain point I'm going to end up with dose number 4?
I think so. And I don't want to sound discouraging, but the reality is that, with BA2 circulating and the fact that it's highly transmissible, and the fact that we have seen vaccines that are effective, but wane over time. I think what that tells us is that we are heading potentially to another dose if we cannot get BA2 under control.
And are we lagging behind in those efforts at all?
Well, right now, the Quebec government has recommended 4th doses for immunocompromised people, right? That's actually been recommended since December. There's a lot of people who haven't had that 4th dose. They've also recommended 3rd dose for the general public, and that's even worse in terms of rates. 53% of the entire province has had a 3rd dose, or 53% of the eligible people in the entire province. If you look at the island of Montreal, it's 43%. So, if people are going to be talking about a 4th dose, what we need to really do is make sure people get their 3rd dose. We need to get BA2 under control. If we can do that, perhaps the bulk of the population won't need a 4th dose. But if we can't get things under control and this BA2 wave drags on, then that means, we risk being continuously exposed to a virus for which our immunity that's from the vaccines will wane over time. And so at some point, that'll favor the virus, and we may need to get a booster. And so if we want to avoid that, we have to act now to sort of save later.
Dr. Vinh, are you at all amazed, surprised, I don't know what word you'd use, when you hear the numbers where they say, well, this is what we believe, when public health says we believe like 3 million Quebecers have gotten, let's say, Omicron or got, what goes through your mind when you hear those numbers of Quebecers that have been infected?
Well, when I hear data, you have to, as a scientist, you have to be a skeptic. I'm not saying pessimist, but just skeptic. Is like, well, what is the source of that data? How reliable is that data? How accurate is it? A reflection of what's going on, in the real world? I mean, that's just science in general. So when I hear numbers like that, you have to say, well, what is that based on? Well, it's based on a testing policy, right? Because you only know somebody has COVID if they were tested. So what was the testing policy? And as we know, then you start getting into like blurry fields, right? Well, wait a minute, we don't all have access to tests, or some of us have access to rapid tests, but that data is not accurately collected, or we don't have access to wastewater data. So then you start asking, well, how reliable or how accurate is this data? And is it an underestimate? Is it overestimate? Is it fiction? I mean, we don't know. So that's the issue, right? And that is what happens when you don't have data. When you don't have data, you don't have the scientific validity that goes along with the declaration of that data, and therefore you don't really plan things out properly. You can't develop accurate policies.
Dr. Vinh, I always end with this question. I call you up and I say, hey, I got tickets for the Habs game. You want to go? You say what?
Well, no. No, for two reasons. First of all, I think the season is gone, and so what's the risk benefit? Well, they're not going to the Cup, that's for sure. So then, do I want to sit around with, I don't know, whatever it is, 40,000 of my closest friends in the city, some of who are not going to be wearing masks and some of who may not be vaccinated, and paying large prices for hot dogs and beer? I think I'll Netflix it, that one.
Fine, I'll go with 21,000 other people. Thanks very much, Dr. Vinh. Be well.
Well, thank you, Elias. Have a good one.
Dr. Donald Vinh from the MUHC.